empowering special needs families. So, Madam Farah, there has been an increase in children with special needs here in Singapore. So, how would you advise families who are taking the critical first steps in their journey with a child with special needs? Yeah, and what role does early intervention play in their development?
Okay, first and foremost, right, you have, as a parent, I think you have to monitor their development milestones, right? Because I think at certain age, there's always a milestone to meet, right? A development to meet. So if, let's say, a child is not able to speak at the age whereby they're supposed to speak, then we have to go one step further to just have a peace of mind to meet the petition and to hear from the petition what's the next step. So if the petitions were saying that yes, your child has a delay in speech, that's where you go to the next step, which is the early intervention. Yeah, that's one way, right? And sometimes at the part whereby when you are told that your child has a delayed speech or no awareness and so on, that's where the parents feel threatened and there's fear in the parent. That's where sometimes the denial kicks in. So when the denial kicks in, right, that's where they are not going to do anything, and also face it's embarrassing to tell people that my child has speech delay, my child is not progressing like any other child in the development. Yeah, so for my advice to the parent is that first, of course, there's fear, there's denial, but sometimes we just have to move ahead despite our denial and despite us being full fear, because at the end of the day, it's the child, it's not us. Yeah, as much as we care about how we feel and what others talk about us, it's about the child. Because we do not want at certain point we will regret, like how come I never take early steps to actually manage this issue about my child. Yeah, so that's what I do. So I went through a grief period whereby I was in denial for 2 years, but throughout that 2 years, because I know that my child is not progressing like developing like any other child, right, I still move on despite the fact I feel denial, right? So in a way, at certain point, right, when Ashraf went for early intervention, it does help. It did help, right, for him to be able to reduce his meltdown and so on. So the moment that you know that the child is delaying something, that's where you go to see a therapist, a speech therapy or occupational therapy and so on. And that's very important because the younger the child is, early you intervene in it, you see the child progress as compared to at later age. Yeah, so early intervention is very important. Yeah, so you can be a state of denial or fear, but just move on. And I think as parents also, you need to research a lot. You have to read a lot. You don't just listen to what people say. People can tell you 101 things, but I think as parent, you have to take that responsibility to learn more, to do more research about, for example, autism. Yeah, what is it about? And then talk to specialists, talk to parents who have child autism, and in a way that you have assurance that your child can get better with early intervention.
So, I mean, like for the education side, I believe the school plays a strong part in this to, in a way, like convince them that it's okay to feel like scared and all. Yeah. So we are here to help, something like that.
Yeah. Okay. Like for example, MIJ Hub, right? So I've met parents who don't know what to do. They have not gone for a diagnosis because they're afraid to hear the fact that my child has autism. So again, I will advise them. I said to have a peace of mind. It's okay. It's just a label. For me, as a caregiver, autism, ID is just a label. It's what comes next. So if a child is not able to speak, a child is not able to read or write and so on, just take the intervention. Yeah, and of course, from parent point of view, you have to also have the support. You cannot just rely on the teachers to do all the job because you come to school for 3 hours, but you are with the child for more than 3 hours. So I think parents also have to play an important role in the intervention process. Yeah, so as far as I remember, in the past, when Asha went for intervention, right, usually the therapist will tell you what to do. So we would take the step also to do it, to reinforce that at home. And that's where I can see that he progressed. Because I still remember my husband, because I was telling him that, hey, I cannot say anything in him. He would tell me, Farah, the therapist is not the sole person that is going to help him. I think as a parent, we also have to help him. It crossed my mind. Hey, yeah, actually, yeah. Yeah, so I think it's very important. Yeah.
On to the next question. So for Dr. Chen, For families seeking healthcare support and services, could you provide guidance on how to navigate the system and connect with the right professionals?
Okay, so again, to answer this question, maybe it will be helpful to first quickly paint out a little bit of the landscape lah, in Singapore in terms of where there may be specialty services for adults with intellectual disability. So first of all, there is the IMH Adult Neurodevelopmental Service, okay, which is run by the psychiatrists in IMH, a group of psychiatrists in IMH in a multidisciplinary team, in which they see adults with intellectual disability and autism
Yep.
for mental health related issues as well as behavioral issues. Yeah, so that is one service that is actually available. To gain access to the IMH Adult Neurodevelopmental Service, the most straightforward way is to, of course, get a referral from a polyclinic or from a CHAS GP clinic.
Yep.
Okay, so that is one one service that's available. The second service that is available is the Minds Clinic. Okay, Minds runs a developmental disability clinic, and this particular clinic actually focuses on assessments. Yeah, so what caregivers and families can expect to receive if they go to this Minds Clinic is that they will expect to get quite a detailed health assessment done by one of the doctors over there, and then thereafter they will then be referred on to other services. For example, referred to the GP, to the polyclinic, to the specialist in the hospitals, and things like that. Okay, yeah. Then of course the third service that is available is ID Health, which is run by my charity. Yeah, in which we take on patients with adults with intellectual disability, as well as adults with autism with higher support needs, and they can come to us directly without any referrals, and for us we would then go through that whole process of supporting them. The good thing is that we work very closely with the IMH ANDS team, so we co-manage many patients together. And I naturally also work very closely with all the different disability agencies, including Minds and many others. So feel free to call us and come to us if they have any needs. We have also established a pool of primary care partners that are willing to work with my team. So families that require support and maybe need help in looking for a GP or a doctor who may be maybe a little bit more suitable can also maybe come to us. And we will see how we can actually facilitate and support as well. Because our role, we see ourselves not only in providing service, but also in really trying to build that ecosystem, that health ecosystem for this population group, and in trying to build capability for that health ecosystem. So we would support the primary care partners and other healthcare professionals in seeing adults with intellectual disability. But in addition to just coming to any of these services, right, I think we must also remember that actually the easiest thing or the easiest service to approach is, of course, if you have a doctor that you know well, your GP that you know well, or your polyclinic doctor that you know well. And these doctors will be able to maybe make the first assessment. But if you have difficulty, or if your doctor verbalizes difficulty, then feel free, ask them to contact us. We are very accessible. The caregivers can also contact us. We are very accessible in that way, and we want to be accessible so that we can then provide the support. Two other things that I just want to quickly highlight is also that Mount Alvernia also has an outreach clinic. And they are very, very open to seeing people with intellectual disability as well. So please feel free to contact them as well, and they are also one of our partners. So if they face any issues, they will also come to us. They also run a dental clinic, right? For individuals. So feel free to contact them also for their dental services. They are extremely helpful. On this note, I also want to just add on that dental care, oral health is a big issue for individuals with intellectual disability. But there is special needs or special oral care dentistry, in Singapore. And there are a number of dentists, not a lot, but there are a number, okay, who actually specialize in this area. Okay, yes, and they are actually located in the different hospitals in Singapore. Yeah, SGH, NUH, Tan Tock Seng, and there are also other services like the Tzu Chi free dental service that also sees some of these adults with intellectual disability. Yeah, so there is actually a network, you know. Yeah, it may not be a very systematic or structured network at the moment, but in all the years that I've been doing this, I have seen this network slowly develop as well. Yeah, and what we hope to be able to do, of course, in the years coming, is to be able to, you know, put them all together, you know, in so that it becomes accessible to everyone, you know, who wants to access all of these services. Yeah, but by and large, I mean, this is just a very brief overview. But if anyone has any questions, they can always feel free to write to us. Yeah, you know, contact us. We'll be happy to help them. Yeah.
Okay, wait, side question. This one, I mean, it doesn't really like come to my mind at all. But why specifically oral and dentistry, like for special needs? I mean, maybe I don't know. Maybe there are some families who didn't really like look into that as well. So like, how come it's very focused to the point where even like dental clinics even like come up with these like specialized?
Okay, so I think a simple way to answer this question is that, you know, actually accessing healthcare in general is very intimidating for all of us. Yeah, you know, you just imagine if you see a doctor, the doctor is going to examine you, is going to do all kinds of things, going to lie you down, going to, you know, maybe take blood from you and all that. And you know, for you and me, we already feel quite scared, right? Yeah,
but we can cope.
We can cope because we can understand what the doctor is saying to us, we can ask questions, we can express all of those things. But you see, people with intellectual disability cannot. So that's why seeing a doctor is already a big challenge. Okay. What about seeing a dentist? What do you think most people in general... and not only that, it is, if you think about it, like even for yourself, between seeing a dentist versus seeing a doctor, which do you feel a little bit more intimidated by? I don't know about you, but dentist. Dentist. Precisely. So most people are quite terrified of seeing the dentist because you feel very vulnerable. You're just lying there with your mouth open, and then you have to cooperate some more, even though you're so scared. And then there's going to be a lot of noises, right? The machines, and
then sensory all start to come.
And then you need to do things into your mouth. So you can imagine that it's going to be extremely terrifying for people with intellectual disability and autism, particularly if they have sensory issues. So again, you just imagine, if it's so terrifying, then what is going to happen? It won't happen. Essentially, that's the answer. It won't happen. The individual may not even want to step into the room. The individual may run away from the place, or the individual may fight against the entire thing because in a way they are fighting for their lives to get away from this scary thing. So again, every time if we try and see it from that perspective, then you'll understand why there are such significant challenges. And then if there are such significant challenges, then you will need some systems or individuals to step up to try to figure out ways to overcome these barriers, you see. So what we did from ID Health perspective is to try and overcome the health barrier, you know, by looking at all the barriers, you know. And from the dental side, of course, then they have to look at the dental side and then try and figure out how to overcome those barriers. So but we work very closely with our dental partners as well, because our patients need to be looked at from head to toe, right?
My mind, what we earlier mentioned, health and education, right? So I think before even the individual with ID reached to the point whereby cannot be helped and to see the dentist, right? That's where we have to educate our child in terms of oral hygiene, right? Like how to brush their teeth and how often you brush your teeth, ways to brush your teeth, all through visuals, because I know that it's the sensory part. It's not easy for them. and the fact that usually when they're not able to speak, right, that's where the challenges comes in. They are more sensory overload in terms of this part of their face. Yes, that's what I noticed. The fact that even touch on the cheek is already a blow mind for them, mind blowing for them. They're like, oh no, don't touch on cheek. What's more, you put toothbrush or a dentist kind of tool into their mouth.
And don't forget that sometimes they are already in discomfort.
Correct.
So you just imagine all of that plus actually you're already in discomfort. It's really it's actually really not easy lah.
But are the doctors trained not as in
the dentist? So
the
this group of dentists who actually specialize in this area, yes, they are trained. They are trained. So they are actually able to work with so many of my patients. I have sent so many of my patients to many of these dentists, and I'm always amazed. With a lot of patience, with a lot of understanding again, you see, of their needs, of where they're coming from. They are able to actually then get the patients to cooperate, build trust again. Because to leave your mouth open for somebody, right, requires a lot of trust, you know.
Correct.
And then, so that's that lah. But I would say that these techniques are also very similar to what we apply in medical care, healthcare as well, blood taking, things like that. It's also through going through these steps. Then you can slowly attempt to do some of these things.
You shared let's say information on the health side, and then for yourself on the education side. So for ID Health and also MIJ Hub, could you guys like elaborate on what a comprehensive focus and unique collaboration can be done between like the both of you?
I think from MIJ side, right, I think there's two things. Hearing what Dr. Chen has her work in Happy Hearts, right? I think first and foremost is our students. Like I said, majority of our adult students, right, they have not gone for full medical checkup. And therefore they and their parents may not know what are the underlying issues. They may have like high blood pressure, they may have or low blood pressure, because some of them have vertigo, always have headache and so on, and some of them like oral health, and they can see the state of their teeth and so on, right? So maybe Happy Hearts can actually, Dr. Chen can actually first advise their parents in terms of their well-being, and also provide the service of having that checkup service here in MIJ to find out about how's their body medical, what state are they in, are they on a health state or moderate state or even like red zone, for example. That's where they can advise the parent what to do. And also I think in terms of diet, because if you can see, right, most of them they ignore their diet, therefore that leads to them being on the heavy side, also having other medical issues, and the next part is about on the parents themselves, because I have parents who come to me saying that they are going to depression, that not able to manage their own child, and they don't have the support from their family members or even immediate family members. So, and this the part whereby I can only advise, but I'm not in the position of an expert to talk about how to overcome depression. So that's where Dr. Chen can comes in, and the team can come in and also advise the parent what to do next. So this is the part I can see.
I think it's really to collaborate, to see how, and partner lah, I think, to see how we can then support the individuals that are now actually attending MIJ, and the future individuals that will come along as well. So that means for the existing individuals, the current individuals, it will be, of course, looking at their chronic healthcare needs and also preventive health needs, right? That's what
Before
I think Farah is actually talking about. So these two is already quite significant already. We look at the ones with chronic health problems, and then also the ones that we want to talk about preventive health, which will also involve working very closely with the caregivers as well. Then of course we would also be very happy to work with MIJ also to maybe share our resources and our knowledge about health with MIJ as well, right? So that the staff here, the team here can then also become more aware, and then some of that knowledge can also be passed on, or they can then pick up things earlier in that sense, right? Then we can then really try and work together lah, to support. So I think that would be really very helpful. And I think on our end also, we also have patients that come to us, like the ones that we mentioned, who have been stuck at home for some time. And for some of them, I think if MIJ actually has vacancies, it could be very suitable for them. As well. So I think it's a very mutual partnership lah. Yeah.
And one part, I think also as a caregiver, I can also maybe share with other caregivers in your the patients that you work with. Sometimes you just want to hear from caregivers' perspective. That's a collaboration that we can do lah.
Thanks. Okay.
We're talking more, I don't know how many months already.
Looking forward to that. Okay, so thank you, Dr. Chen Shiling, and also Madam Faraliza, for today's sharing. Very insightful. I learned quite a number of things also. We have come to the end of our podcast for today. So thank you, Dr. Chen Shiling, and also Madam Faraliza Zainal, for sharing your expertise and insights. So this podcast has shed light on the vital connection between education and also healthcare in the special needs landscape. So for our listeners, it's a message of hope, early action, and also the potential of a brighter future for the special needs individuals. So our journey doesn't end here. We encourage you to connect with our guests, explore the work of MIJ Hub and also ID Health by Happy Hearts, and most importantly, take the lessons from this podcast and apply them to make a difference in the lives of individuals with special needs. So once again, I would like to encourage you guys to follow us on our social media, sharing this episode with your friends and colleagues, and also leave a review or comment if you have any. Then your support helps us to reach a wider audience and also continue our mission of spreading awareness and empowerment. So our journey continues with every step that you take. So thank you once again to our guests, and thank you to our listeners as well. So keep nurturing hope and make a difference. Until next time, stay inspired.